us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so the fourth section we need to go through are current and future strategies to support healthy aging. So I forgot the word current in there. Really sorry. I'm just bad today. Anyway, so current strategies. What are we currently doing? Okay. Preventative health programs, which we have been doing around for ages and ages, such as national screening programs. Not only for the cancers, but particularly when we're talking about aged people, we're looking at things like bowel cancer, which has a higher prevalence there, osteoarthritis, things like that. Government subsidised flu vaxes, falls prevention program, all right, such as Stepping On, which is one that we have in New South Wales here. So these are current things that we're currently doing to help elderly people age healthily and not suffer from the major things that may cause them to have to go into care. The superannuation guarantee is another thing that the government does. It basically, you guys, if you're working at the moment, you know that your employer has to pay a contribution into a super fund of your choice. So the superannuation guarantee basically ensures that working Australians have forced savings. That's pretty much what superannuation is, okay? To reduce the reliance on the age pension. So they don't do this so that you can retire and have a whale of a time. They do this so that you're not a burden on the government, all right? I know it seems weird, and a lot of people are like, I'd rather have the extra money now, but trust me, when you retire and you've got no money in your super and all of a sudden you've got to pay for health expenses or whatever, then you're up the creek. So superannuation guarantee is really quite good, actually. The third one, we've got My Aged Care, all right, which is a government subsidy for the home care packages, which I talked about in the previous section of the video. Looking at making the home safe, but also having people come out to your home to assist you to stay at home. So that could be nursing, it could even be things like domestic services, cleaning, cooking, transportation, stuff like that. All right. So these things are current programs that are helping people stay at home and achieve healthy aging. In the future, what could we do? Okay, and some of these things are already implemented, but they're just not widespread implementation. All right. So the first one, expansion of telehealth and wearable technologies. All right. So we know that telehealth really came to light in COVID, and I have talked in a previous video about how it should continue to grow. But also because if you look at my generation, or like I look at my dad and mum, for example, they know what a computer is. They're pretty tech savvy. They still call me every now and then for issues, but most of the time they can get on and access things. If they didn't have to go to a doctor, that's great. Okay, so the expansion of telehealth will really help people in my generation and below. So even me, for example. The wearable technology one's interesting. So my grandmother has a couple of these things. So fall detectors, vital call buttons, health monitors, right? So these are things that aged people can wear. And so a fall detector very simply detects when there's like a sudden shift in the height of a person, all right? So for example, if it doesn't matter if you're short, if you're here and then all of a sudden you go down 90 centimeters and then you don't move anymore, well, it sort of flags it as a fall, all right? Apple Watches have this, but according to my grandmother, and I do believe her, they're not very accurate, the Apple Watch version of it. But there are devices that you can get that are dedicated fall detectors, all right? Vital call button is very simply, it's like a necklace. You've probably seen like other versions of them. They have them at the gym as well, that people put on like out of hours in case they need to call emergency services and stuff like that. So it's very simply a button, and it's already hooked up to your address and everything, and it just gets an ambulance to you ASAP. But these things, well, not this one, but this one definitely requires you to still be conscious, all right? Because you've actually got to press the button. Health monitors is probably the next step up from these. So imagine if you had like a wearable device like a Fitbit, but it had like multiple indicators on there, like your blood pressure, stress levels, hydration levels, and stuff like that. And if those things start to fluctuate, it could either A, tell the person that, hey, your blood pressure is coming up, just chill out a bit, whatever you're doing, because we don't want to have a cardiac episode. Or maybe it could even detect the fact that your heart may be beating or maybe in fibrillation, so it's not beating accurately. example, you would need an ambulance, so it can do all that automatically. All right. So these telehealth and wearable devices will support independent at-home living, so it stops people having to go into aged care facilities. And it'd be really cool if like the government had like a subsidy scheme where it's like, okay, you're now 65, you get a free VitaCall button and a fall detector, you know, have them. Whether the person wears them or not, up to them, because a lot of them maybe have achieved healthy age and they're like, I don't need these things, but you've got them just in case you do need them. And that would be cool. Next one, because of the growing and aging population, we need to grow our aged care workforce. All right. So remember, we talked earlier about beds being an issue, but sometimes beds is based off staffing ratios. Well, we need more staff. All right. We need more nurses trained, and we need more aged care workers trained, and we need more nurses trained who are specialised in aged care and dementia, etc. And the government can do this like through offering incentives, like we will pay for your 3 years at university and your 6 months, specialized or 12-month specialization course in dementia or whatever. If you then sign a contract to say that you will work for 10 years in aged care or something like that. It's usually not 10 years, it's usually like 5 years or something like that. But a lot of people will take that, right? Especially if you're already considering nursing. It's like, oh, the government's going to pay for me to go to uni and get my degree, and then they're going to guarantee me a job for 5 years. All right, that sounds like a great deal, and a lot of time it is a great deal. All right, so these are the things that the government can do to enhance the workforce. And the last one is just increase research around dementia, okay, and development of like dementia-friendly communities. Now, I'm not exactly sure what that would look like. I guess a lot of the time in aged care facilities, if you have a mix of aged care people without dementia and aged care people with dementia, it could be very unsettling for the people without dementia because, there are people with dementia who may not interact with them the same on a daily or even hourly basis, or they could pose a risk. But imagine if there was like aged care facilities that were like dementia only, for example. All the staff would be specialised trained in dementia, and they would have, hopefully by that time, more research around how to best help people with dementia and make the families who come in to visit their loved ones feel accepted, and it would all just be very nice, okay, for want of a better word. So they're just some current and future strategies that we can do to support healthy aging. Now we have one more syllabus dot point left. Okay, so finally we've got our government and non-government organisations considerations. All right, so what should these entities be doing to help the ageing population? So government first, sustainable funding. Sustainable funding is the first one. It's, everyone complains every year about the budget, but geez, I'd hate to be in control of the budget for a country, all right? And if we're looking at a projected increase in the amount of people 65 and over, a lot of that budget, decisions need to be made now to help those people achieve healthy aging. So that's not only like increased funding towards health prevention programs and things like that, but also increased development and building of aged care facilities, increased training, etc. Like it's a lot of stuff that go into the budget, and we need to think about that. But then you can't spend all of the money or too much money, because then interest rates go up and etc. etc. So. Next one, infrastructure and urban planning, all right? So think of like aged-friendly environments. If you've got a large community of aged people living in an area, how do those people interact and get around safely, all right? So things like, rails, things like ramps instead of stairs. Accessibility, like if an aged person wants to go down to the shops, just to Coles and get, a bunch of bananas, but they've got to go down 2 sets of stairs and they've got to cross a very busy road that doesn't have like a crossing or an intersection, well, that poses a massive challenge for that person. I mean, you and I can probably just run across it, but and go down the stairs, but for that person, not happening, all right? So the local communities need to plan for this stuff when they, if they see like an increase in aged population, or if they see an aged care facility has been built somewhere, then the environment around it and the community needs to have these things, all right? Because obviously you're gonna have more people, you need to make it safe. More public transport, okay, for aged people to use. More aged care facilities in general for people to use, all right? Little things like extending the crossing times for aged people with mobility walkers. So like I said, imagine you've got that aged care facility and there's a crossing right out the front, and across the road there's a Coles, all right? So usually the little green man, red man thing is like, 10 seconds? But we know this one is outside an aged care facility. Let's make it 20 seconds. Let's double it, all right? So that those people who have walkers and things can get across safely without making everyone upset and whatever, which is something called ageism, which we'll get to soon. So those things. And then finally, the workforce planning. I touched on it in the previous one, but providing incentives and stuff, because if the aging population is increasing and we already have a workforce shortage for people in the aged care workforce, then we need to get on top of that and get way more workers, because it's only going to get worse. Non-government organisations. So what can these guys do? So the major ones are going to be our service delivery. All right. So we currently have services like Meals on Wheels, which delivers fresh food and cooked meals for aged people to heat up and eat and stuff. Community transport, like little minibuses that you've probably seen them all the time. They drive around and they help deliver aged people to where they need to go for free, etc., or heavily subsidised. Increased aging people means there's going to be an increased demand in these services. So these services need to be recruiting more and maybe making larger facilities and making more meals in one, cook up and stuff like that. So everything needs to go up. Advocacy and education, all right? So we've got something called the Council of the Aging, or COTA, and Dementia Australia, which is another group. So these guys advocate and try and educate people on the effects of aging and healthy aging. Dementia Australia obviously focuses on the risks and causes and what you can do for people that have dementia. Education around this stuff will hopefully reduce this concept in the public called ageism. So ageism, think of it like racism, but it's against elderly people, okay? Not necessarily a race at all. People just get frustrated and upset by old people. Like, oh, hurry up, mate, or oh, what are you doing, mate, or oh, I'll get your change out, or, you go to the shops and listen for it. You'll hear it all the time, all right? This is actually one of the reasons why, actually, I should write it up. It's a good example. They have like a pensioners day at the shops most of the time. And it's not just for pensioners, but basically, they might have even reworded it these days, because it was pensioners day when I used to work at the shops, which is a long time ago. So let's assume this has been reworded to something more friendly, like, aged day. I don't know. It's like one day of the week. It was like Wednesday, where everybody knew that it was, pensioners day. So people expected there to be more aged people at the shops. So people that may be the ones getting upset with aged people would avoid the shops. Like, it was a positive spin. It wasn't a negative thing. And the aged people there felt more comfortable to take their time and, use their walkers and take 20 minutes to get, 5 cents out of their wallet and stuff, because that was okay. It was okay. It's okay. All right. We don't need to hassle them. Leave them alone. Last one. Gap filling, okay? This is just a generic thing I just threw on the board. Non-government organisations, they've got all these services, they're doing education and stuff. They need to gap fill, all right, where the government isn't allocating enough funds, all right? So things like social services, and I don't mean social services as mean like social, I should probably reword that. What I mean by social services, I mean by services that encourage aged people interacting with each other, okay? So, like social groups and things like that. Physical activity programs, like, my daughter's school, for example, they've got this little minibus that comes in on Fridays and delivers like a range of different activities. Well, do the same thing for aged people, okay? Imagine that, they'd love it, all right? Wearable technology, we touched on that already, but, NGOs have a really big part in this by getting wearable technology out to aged people that need it. And then other community programs, like I mentioned before, like library groups and, could be restaurant stuff and, whatever. So the idea behind this is to cover the needs of the aged, which the government is not or cannot due to funding constraints up here. So they were the 5 syllabus points that we needed to cover for the impact of the aging population here in Australia. Thanks.